A type 2C pattern of root tear, as described by Laprade, can be best addressed by a double row repair. And in this particular patient, we are doing a double row arthroscopic root repair to fix the root and to include the attached portion on the lateral side as well. The stump is also to be integrated to the root. So here we are using two anchors, both Rootfix anchor, to repair the root back into its position. The first Rootfix anchor is inserted in a more lateral position, and this will be used to do margin convergence suture, repairing the stump as well as the main meniscus root part. So this is the Rootfix anchor, which is now deployed onto the lateral aspect exactly at the root attachment, and these four suture limbs which are there will be used to margin convergence and repair the stump as well. The second anchor will be at a more medial position, and that will incorporate the main meniscus fragment root, and that is the fragment which is to be reduced in order to reduce the excursion part. So here the second Rootfix anchor will actually function to repair the main meniscus fragment into its place. So this is equivalent of a double tunnel technique as described by Laprade, using two anchors into their respective positions to form a broad attachment to the meniscus root and repair the meniscus root in a fashion which is a double row type of repair, giving a broad insertion to the root and repairing the root in a correct way. Both the anchors are deployed, then we will be using different suture patterns, shuttling patterns. Here we are using a knee scorpion and trying to pass the sutures first on the stump, that is the lateral fragment. Both the suture limbs are passed through the stump, and then the suture limbs are passed sequentially into the main meniscus fragment, and this will lead to a very nice closing effect of the side to side pattern, like a margin convergence technique for the medial side. So this is the suture passing which is important, and once the suture passing is there, so since because there is a large number of meniscus fragments in meniscus suture limbs inside, so we might have to do a little bit of suture management tricks just as we do in the rotator cuff, but finally in the end we will have a very nice repair which is obtained. The second anchor, which is going through the main meniscus fragment, is now used, and again meniscus scorpion, knee scorpion is used to pass the suture sequentially through that fragment as well. And as we pass, we need to pass it in a mattress fashion, so all the four suture limbs are passed sequentially into the meniscus limb, and this will lead to a very good closure of the meniscus into its place. So once we are done with this suture passage, then we can do the knot tying and at its perfect position, and once the knot tying is done, we can see that the meniscus is repaired back into its place at a very meticulous place. You can see the final picture shows a very nice meniscus repair. The root is absolutely reduced back into its normal place.